Welcome to the Preventative Services Program Screener Training. By completing this training course, you will be eligible to take part as a screener in a PSP event. Thank you for your interest and participation. The course will take approximately 30 minutes to complete. To advance through the PowerPoint slides, press the right arrow on your keyboard or left click on your mouse. You may stop and start this course at any time. At the conclusion of the course, you will be directed to complete a form which will register your completion of this course. Completing this form is essential to accurate accounting. You will be asked to insert a completion code when completing this form. The code is SCREENER. This course will provide you with a basic overview of the PSP program, assist you in preparing an area for screening, and prepare you to properly complete the PSP screening form. The intent of PSP is to mobilize a community toward protecting the oral health of its children. People across Missouri are gathering together for PSP events to make a difference where they live. Essential to the success of the PSP is the community-wide involvement of various groups toward this common goal of children's oral health. Examples of these groups include schools, child care facilities, dental professionals, hospitals, and businesses. PSP has 4 components. The first component is surveillance. A screening of the oral health of a community's children is conducted once per year by a dentist or dental hygienist. Secondly, oral health educational materials and programs are built into the PSP structure. Prevention is the third component of PSP. To prevent dental decay, fluoride varnish is applied twice per year by community volunteers. The fourth component is referral. Children identified as needing early or urgent treatment are referred for care. PSP is designed for children of all ages, infants through high school. You will be one of many involved in a PSP event. As you can see from this chart, it takes many hands working together to implement a PSP event. Dental professionals serve as the screeners. Parents, nurses, and others interested in assisting apply the varnish. And there is also room for others to do education, hand out materials, and assist as recorders for the screeners. What is a screening? Please know that this screening is not meant to be a thorough clinical exam. No radiographs will be made. This screening will not result in a diagnosis or a treatment plan. The screening is designed to identify obvious oral lesions and provide a profile of the oral health of the children in a community. The Department of Health and Senior Services, DHSS, Oral Health Program provides free of charge many of the supplies that are necessary for a PSP event. These include screening forms, disposable mouth mirrors, toothbrushes, toothpaste, floss, and educational materials. These will be ordered by the coordinator of your local event. There are some other items you may need to supply. These may include face masks, gloves, a light source, eyewear, and hand sanitizer. These may or may not be provided by the coordinator of the event. Please check on this to verify what you will need to bring with you to the screening. It is best to have an area with good lighting. A straight-back chair will be adequate for the screening. A tabletop or desk near your work area will make your supplies easy to access. A tip you may wish to use: position the chair near the wall so that the child can tilt his or her head back and rest the head into a steady position. You may conduct the screening standing or sitting, whatever is most comfortable to you. It will be easier to see in the mouths of infants and toddlers if you use knee-to-knee positioning, also known as a lap exam position. Be discreet in your findings to maintain the child's privacy. Some children will have dental decay and poor oral hygiene. Position the screening area away from waiting crowds of children. Use routine infection control guidelines. New gloves and a new mouth mirror are to be used with each child. A mask will decrease your chances of contracting colds and flu. You may choose to use a hand disinfectant frequently throughout the day. PSP uses the format of the Basic Screening Survey, which is a tool endorsed by the American Association of State and Territorial Dental Directors. DHSS will provide as many survey forms as you need. Only licensed dental professionals may conduct the screenings. Licensed dental professionals will be familiar with both primary and permanent teeth, as well as normal and unusual findings. The surveillance data will be used by Missouri to report the oral conditions of our children. Therefore, we need the reports to be as accurate as possible. DHSS will supply large envelopes with postage-paid labels for returning the screening forms. The event coordinator will take care of this at the end of the event. Upon receipt of the completed screening forms, DHSS will scan the screening information into our database and generate reports on the results. This will provide an overall profile of the oral health of the children screened. No individual child will be identified. The data will be reported as aggregate for your event or area. The forms may be completed in either pencil or pen. It is important the marks made on the forms are made dark enough so that the scanner can read them. In marking the categories, it is essential that each circle be completely filled in. Please do not use check marks, dashes, or lines. Some recorders find that using a permanent fine-tipped marker works very well for coloring in the circles. It may be necessary, though, to use a sheet of paper under the screening form to prevent bleed-through to the other screening forms. Simply fill in the circle to mark the appropriate response to each category. If an error is made, please discard the form and begin again. The screening date is the date the event is taking place. The school name is simply the name of the school. Minor abbreviations for the school code are acceptable, but please avoid vague 2 to 3 letter abbreviations. For example, in Poplar Bluff, you may wish to write POP BLF. Avoid the brief abbreviation of PB. The screener name, your name with at least your first initial followed by your full last name. To save time, it is allowed to write your first and last initials on the screening forms. If you have entered your full name several times on screening forms during a screening event. Categories 1, 2, and 8 on the screening form request demographical data. This information provides a profile of the population. Number 1, gender is determined by visual observation. Number 2, race. Select the race of the child based on your best determination. Number 8, age. You may wish to ask the child for this information. In the interest of saving time, the information for categories 1, 2, and 8 may be collected by someone who is assisting as a recorder. Be sure you have good light in the room and that you use the mouth mirror for retraction. Please do not give the mouth mirror to the child to keep. The mirrors become toys and are often passed from one child's mouth to another. It is acceptable to give the mirror to the child to carry over to the person doing the varnish if the varnish is being done at this time. The category of oral hygiene is number 3 on the screening form. This is an overall determination of the presence of soft deposit and its effects on gingival tissues. The mark of not satisfactory is reserved for moderate to heavy plaque or materia alba and red enlarged tissues. If there is little to no visible plaque or materia alba present and the tissues are, for the most part, pink and firm, mark the child's oral hygiene as satisfactory. The category of treated decay is number 4 on the screening form. Note, the categories here are specific to the types of teeth within the mouth. For example, primary teeth only, primary and permanent teeth, or permanent teeth only. Mark treated decay when you note any of the following: restorations, either temporary or permanent, restorations, whether partially or fully retained, crowns, placed due to decay, or missing teeth as a result of decay. Restored or missing teeth that are not a result of decay are not to be considered as treated decay. The category of sealants is number 5 on the screening form. Only record sealants that are present on permanent molars. As you know, sealants come in many different shades from clear to white to pink. Some are translucent and some are opaque. Use your best judgment. If you have the time and the resources, You can use a toothpick to skim the occlusal surfaces. This sometimes helps in determining the presence of sealants. If you see a sealant, and it is only partially retained, still mark sealants. You will need to discriminate between sealants and glass ionomer composite restorations. The category of rampant caries is number 6 on the screening form. If you see evidence of decay, restorations, or missing teeth which are a result of decay on 7 or more teeth, please mark yes in this category. The key here is 7. 7 or more teeth impacted in any way by decay. Here is an example of rampant caries. This is noted by the obvious dental decay on 7 or more teeth. This is also an example of early childhood caries. The category of white spot lesions is number 7 on the screening form. White spot lesions are seen as a precursor to early childhood caries. This category is to be used only with the children who have primary teeth. On the primary maxillary anterior teeth, you will be looking for the presence of white spot lesions. This category asks you to mark yes if white spot lesions are present on the maxillary anterior teeth of a child age 3 or under. Lifting up the lip will allow for easy observation. Both categories 7 and 11, early childhood caries and white spot lesions, can be screened for at the same time. Remember, white spot lesions are only noted on primary maxillary anterior teeth. Here is an example of a white spot lesion. Note that the lesion is on the maxillary anterior tooth of a primary tooth. The category of untreated decay is number 9 on the screening form. Note that once again, in this section, the categories are specific to the types of teeth within the mouth. For example, primary teeth only, primary and permanent teeth, or permanent teeth only. An area is coded as suspected untreated decay when the screener can readily observe both a loss of at least 0.5 millimeter of tooth structure at the enamel surface and brown or darkening discoloration of the tooth structure. Here are some other points to consider when coding untreated decay. Retained roots resulting from severely broken down decayed teeth are considered untreated decay. Chipped or broken teeth are considered sound unless decay is also present. Temporary fillings are not to be considered as untreated decay. When in doubt about the presence of decay, or any other condition for that matter, be conservative. The category of treatment urgency is number 10 on the screening form. There are 3 choices in this category. They are no obvious problem, early dental care, and urgent care. When marking no obvious problem, you are indicating that there are no obvious signs of need for current treatment. By this you mean there is no need at this time for dental treatment, but the child should see a dentist for regular checkups. This is an example of no obvious problem. When marking early dental care, you are indicating that treatment is needed within several weeks of screening. In other words, the child is not in immediate pain, but some early treatment is probably needed before the next regular dental exam. This slide outlines 4 types of conditions that might require early dental care. These include a cavitated lesion with no pain or infection but needs treatment, a precavitated lesion, spontaneously bleeding gums, or a suspicious white or red soft tissue lesion. This is an example of a child that would be marked as needing early dental care. Note that there is obvious decay on teeth A and J. This is noted by the loss of at least 0.5 millimeter of tooth structure and darkening of the surrounding occlusal surfaces. Remember, you may also choose to mark early dental care for those individuals with spontaneously bleeding gums or suspicious white or red soft tissue lesions. Any of these conditions would constitute a need for early dental care. Urgent care is marked when you feel that treatment should be given to the child within 24 hours of screening. This may be due to the presence of an abscess, a draining fistula, or a swelling or other painful ulceration. This is also the category you should mark if the child has limitations to his or her daily living activities due to dental pain. These activities include eating, playing, going to school, or sleeping. You may need to ask the child, parent, or caregiver, if available, some questions to ascertain this information. Here is an obvious example of a condition that would be marked as urgent care. Note the buccal abscess. Here is another example of a condition that would warrant the mark of urgent care. The category of early childhood caries is number 11 on the screening form. This category directs you to look at the primary teeth. This category asks you to mark yes if decay, restorations, or teeth are missing due to decay on one or more of the maxillary anterior teeth of a child with primary anterior teeth still present, typically age 5 and under. It will be necessary to lift the lip to accurately screen. It also may require that you determine if missing teeth were caused by decay. This information might need to come from the parent or caregiver. Remember, this category is for the maxillary anterior primary teeth and indicates evidence of early childhood caries. This is an example of early childhood caries because of the presence of caries on the primary maxillary anterior teeth. Let's take a look at some photos and try some simulations. How would you mark this one? Would you consider it untreated decay? Sure. The presence of darkness on the first molar and the loss of at least a 0.5 millimeter of tooth structure indicates that category. How about this one? Untreated decay? White spot lesions? The answer is yes to both questions. This is an excellent example of white spot lesions. Of course, you would also mark this as untreated decay. What would you say about this tooth? In the treatment urgency category, would you mark no obvious problem, early dental care, or urgent care? This appears to be stained pits only. Therefore, no obvious problem is indicated. Please remember, if you are in doubt, be conservative. What would you say about the conditions in this mouth? How would you mark the treatment urgency category? No obvious problem, early dental care, or urgent care? Decay appears to be large and chronic. No pain or swellings or draining fistula are noted. It is likely that this child is in the early dental care category. However, if you feel that this child is in pain or that the lesions are likely to cause pain soon, you are free to override the early dental care category and place this child in the urgent care category. What would you say about the conditions in this mouth? How would you mark the treatment urgency category? No obvious problem, early dental care, or urgent care? The presence of a periapical swelling likely puts this child in an urgent care category. This now completes the screener training course. To participate as a screener in a PSP event, please complete the registration form on the web page. In order to obtain CEUs, you must also participate in the questionnaire on the web page. You must answer each question correctly in order to automatically be allowed to move on to the next question. After answering all questions correctly, you will be directed to a downloadable and printable certificate of 1 CEU for your records. Thank you for joining with others to improve the oral health of Missouri's children. If you have any questions, please contact the Oral Health Program at 800-891-7415 or visit our website at health.mo.gov. Enter oral health into the search engine and you will be able to locate information regarding oral health and the Preventative Services Program. Thank you.